Thanks very much for joining us for the daily update. Firstly, there are 13,469 cumulative cases of coronavirus in Victoria. That's 471 more than our last update. I'm saddened to have to report that the total number of fatalities due to this global pandemic is now 170 Victorians. That's 8 additional deaths since we last updated you. 2 men in their 60s, 3 men and 2 women in their 80s, and 1 woman in her 90s. 4 of those 8 cases are linked to aged care. In terms of testing, I'm afraid I don't have a total number today, but we are assured by the laboratories that we've done about 25,000 additional tests yesterday, and those numbers are of course reflected in terms of the positive case count that we've just given you. There are 107 additional mystery cases, 107 additional community transmissions. They won't be from today's data, and those cases that are under investigation, that'll lag behind a day or two, but that's from that coronavirus detective work that's been done from yesterday's numbers and the numbers the day before. The total active cases is 7,449, and the total active cases that have a link to aged care are 1,533, noting that is both residents and staff. That, I think, essentially concludes the numbers that I needed to give you today. Alan, of course, is here and can provide any further information once I'm finished going through some other matters. I just wanted to go through a couple of other industries, and there's been, as you well know, there's been many roundtables, many hundreds and hundreds of individual discussions with different sectors. And the first thing I wanted to say was how grateful I am to each of those industry peaks, each of those large employers, even many smaller employers that we've been speaking to. This is always an imperfect process. It's never been done before. There may need to be further changes that we make based on further feedback that we get in the running. But we're very grateful to all of those who've worked so positively with us in a partnership to try and fundamentally reduce the amount of movement across the Victorian community, to in turn drive down the number of cases across the Victorian community. Now, obviously those permitted workplaces in broad terms, those who are allowed to be open and those who must be closed, that list was finalised yesterday. Any specific questions that you have, I'm more than happy to. There's a big team that are providing clarity and advice to many different industries, and I'm more than happy to follow up on any specific instances or questions that you have. We can do that as quickly as possible before you have to file or go to air. There is a second category, as you know, those industries that are not necessarily closing, but they are reducing their workforce and therefore their output. And I just wanted to give you an update on the work that's gone on over these last 72 hours, and we're very close to being able to land this, and there'll be some further documentation that we'll be able to make available to you in much more detailed terms in the next few hours. So meat processing and abattoirs, that whole sector has been obviously very high risk. We've seen a number of outbreaks. We've seen some very real challenges in that industry. Off the back, and I thank that industry for a very productive way in which they've engaged with us and our public health team, and I can confirm that we will land final arrangements by midnight tomorrow night that will see red meat, so beef, lamb and indeed pork will go down to 66%, so 2/3 of their operation based on their operations last month, or based on their staff numbers over a 3-month continuous period at some other time in the year. So whilst they are down in terms of their total amount of work, they will be going down further to that 2/3 level. In terms of poultry, the difference in life cycle of those birds means that if you were to reduce down to that, say, 66% number, then there would be many hundreds of thousands of animals that were essentially destroyed but not processed, and that would lead, I think, to some very significant shortages of product. So they will be, by agreement, going down to an 80% level. We think that is the appropriate balance. All of these measures are about driving down the number of workers to the lowest number we can practically get to, whilst at the same time not delivering critical shortages of product. Therefore, there are balance points to be found, and we're confident that we have been able to do that. For seafood, those centres that are below 40 staff, these rules won't apply. We think it gets to a critical mass point if you start to try and reduce workforces in such small centres, and also for other abattoirs beyond seafood, so red meat particularly, if they have less than 25 employees, then we will not apply those 2/3 staff level rules, if you like. I want to make the point as well, 2 points. There are very strict COVID safe plans that apply to each and every one of these settings. Everything from testing, temperature checking, PPE. There will be compliance officers that are on site to make sure that all of these rules are followed. It's in everybody's interest, particularly those businesses, to make sure that we're all doing everything we can to keep the virus out, to cut the amount of movement, to cut the amount of cases that we have across the community, and we don't want to have that compromised in any way. So that's why there'll be not only a partnership around the broad settings, but on a case-by-case basis, a shop floor by shop floor. There'll be even more work will be done for each and every shift. Moving to construction, this is a little bit simpler. In terms of construction, the settings that I had outlined will in fact be delivered. So if you look at very large government jobs, they're already at about 50%. We're aiming to drive that down across the entire portfolio, down to as close to 25% as we can get without compromising safety. And you would appreciate that if you're building hospitals or fitting out ICU wards, that's really important work, and perhaps never been more important than it is right now. There are a number of train lines that are closed at the moment, and in order to return them back to the public transport network, then obviously we need to get that job done. But we're going to try and deliver that 25% across the board, so as close as we possibly can to what we are asking of others. In terms of the second category in the construction sector, the above 3 stories, so these are private sector jobs, they'll go down to 25%. We know that'll be difficult, be very challenging, but again, if we don't limit movement, we won't limit cases, and we will be in these restrictions for longer than we should otherwise be. The third category in terms of construction, so domestic building homes in the suburbs, those arrangements are, as I had outlined on Monday and again yesterday. I think Rich asked me some questions. No more than 5 staff on site at any one time. There will be limited movement allowed, particularly for specialist trades who, once they've completed their task, they need to move to the next home. And building supervisors, people who are running those teams of tradespeople, they'll also be able to move between sites. But there are strict COVID safe plans in place for that industry, and I'm very grateful to that industry for the enormous amount of work that's gone on. It was a very long night, a very late night trying to settle these matters, but I'm very grateful to them. No one enjoys having to wind back activity in any part of the economy, and no one certainly enjoys potentially putting timelines off. But if we're going to drive down these numbers, we've got to limit the activity that's going on, the amount of movement that's going on right across the community. The third area, before we take your questions, the third area is in relation to warehousing and important distribution centres. So we've given an extension to supermarkets and to those warehouses and distribution centres, particularly that relate to medical equipment. So whether that be everything from PPE through to pharma, all of those things, I think it's appropriate to give them a little bit of extra time. Instead of them delivering these reductions in workforce by midnight tomorrow night, they will deliver that by midnight Sunday. We think that's a sensible balance for us to be able to strike. They too have COVID safe plans in place. They'll be even stricter. And the important thing here is that they will reduce, particularly for supermarkets, they will reduce their overall workforce across distribution and indeed across their entire functions. So all the way across their business, they'll bring those numbers down to that 2/3 level. Again, I want to thank our supermarkets and our supermarket workers. They've done an amazing job for months and months now, and we're all very grateful to them. I just want to, finally, before questions, I just want to make the point, these specific plans are about trying to strike a balance between driving down the number of people that are going to and from work, the number of people who are congregating for work in one place, but also making sure that there's enough food on the shelves. There's no need for people to be going out and buying up. There's no need for people to be trying to stockpile months and months of food. We have, to the best of all of our collective abilities, we have tried to get that balance between reducing the amount of movement, therefore reducing the number of cases, but not compromising what you need being on the supermarket shelves. You may not necessarily be able to get exactly the cut of meat that you want, but you will get what you need, and you will get all the products that are basically that are fundamentally important to you. They will be there. It'll only make things harder if people who have the means to do it go and buy enormous quantities of food. That'll just mean that other people potentially don't get the things that they need. That's why the supermarkets have put a number of buying limits in place. But I'll just say a lot of work has gone into driving down staff levels, but at the same time protecting the amount of product that will be on supermarket shelves. That's our aim. That's what we think we can confidently deliver. But every Victorian consumer can play their part in delivering that outcome by following the rules, going shopping within 5 kilometres, one person per day, buy what you need. There's no need to buy 3 months worth of meat. That will only make it harder to make sure everybody else has got what they need. Plus, we are confident that we can continue with these production levels and meet the needs of the Victorian community. I think that essentially covers everything that I needed to update you on. So Alan and I are happy to take any questions you've got.
Alan, just take us through the cases today and the outbreaks.
Sure, I think most outbreaks are probably going to come to you in the Cho media release, but I'm happy for Alan to make some comments.
Yeah, the question was about outbreaks, was it? Yeah.
Take us through which outbreaks have grown the most since this time yesterday.
Yeah, that'll come out in the CHO report later today.
How many of these cases at the moment, the Premier's just spoken about distribution centres, how many cases are linked to distribution centres?
There certainly have been a number of cases, both in major distribution centres. I think it's partly reflects the nature of the work and the sort of the conditions there. I couldn't give you an exact figure, but we can get back to you on that.
Isn't it part of the problem though? You said for weeks you couldn't shut down these places, but this was where the transmission was occurring. Have you got how do you know if you've got the balance right?
Look, I think the principle that Brett and I have been giving is really that we need to try and reduce any opportunity for spread. Certainly, aged care is one of the hotspots, but certainly distribution centres are also one of the hotspots. So the real question is it absolutely necessary for the functioning of society, for people to eat and so on, and can that risk be reduced as much as possible by thinning out the workforce and the crowding in some of these places?
And the modelling reported today, supposedly from the Victorian government, more than 1,000 cases a day. Can you tell us if that is from the Victorian government?
So I first went to check our internal modelling. I also checked with the Commonwealth, with Brendan Murphy's team. We can't find anything that looks like that. So I'm not sure.
So what is your modelling?
So what it suggests at the moment is the effective reproduction rate is probably sitting around 1, which means that we will on last week's settings we would have seen cases continue. We hope that we will see a decrease in cases, but we won't see them immediately. We'll see them decreasing probably over the next 7 to 10 days as these things cut in.
Can I ask if you can give an estimate? I've been told the really hopeful estimate is maybe 20 cases a day at the end of the 6 weeks. Maybe the more realistic one is 100 to 200 cases a day by the end of the 6 weeks. Can you give people a number that you're thinking might be possible?
Look, I don't want to be pinned to a number, but I would hope that it's substantially less than what it is now, and we would start to see that starting over the next, starting next week and over the coming weeks after that.
What is your model saying? What is your model?
Look, I can probably give you sort of a description of sort of where we might have been. So, on the 25th of June, we first hit 20 cases in this second phase. On the 11th of July, 16 days later, we hit 200 cases. We first hit 200 cases. So what that would imply, if we had continued with that same growth rate, that 16 days after that, which would be the 27th of July, we would have hit 2,000 cases, and by next week, the 12th of August, we would have hit 20,000 cases. Now, clearly, we're not even at 2,000 cases, but the numbers at the moment are certainly too high, and we really need to get that down. So an R effective of 1, so constant rate is still too high, and we need to get this down so that we can sort of get everything back to some sort of normal again.
Have you seen modelling that indicates 1,000 a day over the next few weeks? Have you seen any modelling?
I have not seen any modelling that suggests that.
So have you done modelling based on what you expect to happen now in stage 4? And if so, why can't that be released? Because it's surely appropriate for the Victorian community to understand that what we are doing now will work.
So when we do modelling, there's, to coin a phrase, there are sort of known knowns and known unknowns. So we think we know where we are now. We have these 471 cases today and the cases from yesterday. But the exact reduction in the effective reproductive ratio, we don't know for sure. We know that it's going to be lower, but we don't know how much lower it is. So I could give you a range of figures that we would expect to see next week. It won't start to begin from next week, but I don't think that modelling is particularly helpful, other than to say that we expect it to start decreasing from next week, and it should be lower.
You don't think it's effective in trying to encourage Victorians to do the right thing instead of trying to get around the rules?
Look, I think the message has really been consistent. It's less about rules and more about, do you really need to go out? And the better that everyone does it, the quicker that we'll be able to get this down.
Why not release that documentation to the public so that the public can know what the government is expecting these restrictions to do?
We'll release what's possible, but there's a lot of uncertainty around these sorts of things, and we expect it to go down. An exact figure, the danger with an exact figure, it gives an illusion of certainty, and we certainly don't have that certainty. We really need everyone. The principle is we really need to get our people to do the right thing, to reduce transmissions and to get that number down as much as possible.
Obviously today your department and the government would have made inquiries about those reports that were in the papers today. Yep. Have you been able to establish where that modelling has come from?
No, I've not seen anything that looks like that.
And have you have made inquiries?
I'm more than happy to add something there. Well, firstly, calling it modelling might not necessarily be the most accurate term. But the bloke who's in charge of the modelling has never seen it. Brendan Murphy has never seen it. No one in the government has ever seen it. And that point could have been made last night, but the first we heard of the story was when it was printed. So I can only be frank with you. In terms of releasing modelling, modelling gets better and more accurate every day that we have stage 4 going. So as stage 4 continues, if we can not only be reporting the actual data, but and I think you understand, if you can give us a little bit more time to then input that actual data, then that's the assumptions that the model's built on, and the model will be far more accurate. I think there is a fine balance here, as Alan said, not to give people a sense, oh, well, it's all going to be fine and I don't have to play my part. We don't want that. And the other thing too is that you can get some wildly inaccurate pictures of what the future might hold, because it's not based on real data, it's based on your theory, if you like. So what we'll do, if we can, based on more real data as days in stage 4 pass, then we're more than happy to try and update you. Ultimately, this strategy will only work, though, not in theory, but in practice. It will only work in real terms if everyone follows the rules and if we see everybody taking this seriously, and I'm confident that Victorians will, both in terms of the conduct and the choices they make, but also some of the enforcement and the compliance arrangements that we've put in place also. I wouldn't describe that as modelling. No one in charge of modelling has seen it. Again, as I said, that point could have been made at an earlier point, but first we learnt of it was when it was published this morning. Ultimately, no one in the federal government or the state government has seen it.
Just on the with reduction of
Sure.
staff, are they going to be working longer hours to keep up? Is it a third reduction of output, or is it just staffing?
Staffing, and we'll also make sure that we're trying to thin out shifts as much as we can. That's about distance, it's about less people on site. But what I would just say to you, for instance, and I, you know, it's very challenging to have to say no to this, but we had a number in the construction sector said, well, what if we had one shift at 25% and then we did a second shift, which is not the usual way the construction sector works, and it'll be 25% as well. The problem with that is that when you add it up, that's 50% of the workforce. That's not 25% of the workforce. So we've had to make some really difficult decisions, and I fully acknowledge and understand how difficult this will be, but we can't have a situation where, you know, you were doing 4 shifts at 25% each. That would be basically the same number as you would be when you're at full tilt. We have to have less people going to work. That's very painful. That's very difficult. But a little bit like high risk and low risk, ultimately there's an aggregate risk. So whether it's a high risk setting or not, general movement with these mystery cases, you know, people that don't work in a high risk industry, they don't know each other. They're in 1 or 2 streets away from each other. No one knows how they picked it up. The only assumption can be that sort of general movement moving throughout their local community may have been where they got it. So we're targeted as best we can be, but beyond that though, the aggregate number of people moving around the community has to be reduced as well.
My question was actually about, will those reduction in workforce, will they be able to work longer shifts to keep up the output at some of those abattoirs?
I don't think that they'll need to work longer shifts. I think that they'll finish up working pretty much the same structure. They will be producing less, but in answering the question, I wouldn't want anyone to think that there's going to be empty shelves. We will do everything we possibly can, not just the government, but our public health team, our compliance team, supermarkets, butchers, bakers, people who are stacking shelves. Everyone will do their utmost, their absolute best to make sure that there is what you need on the shelf. I can't guarantee that every cut of meat you might want, every cut of meat that you might want in the quantity that you might want it will be there, but we're doing everything we can to strike that really challenging balance between reducing the number of workers so we reduce the number of COVID cases, but maintaining the stock and the supply of food and other basics.
This morning was saying that they still weren't okay with the resolutions that have been put in. Have you now spoken, are you saying in the last, let's say, 4 or 5 hours that you now think that businesses are happy with the balance
I don't think any business will be happy with the decisions that have had to be made. I'm not happy to have to make these decisions, but sadly we don't have the luxury of finding things, of that being the ultimate guide. The guide here has got to be to drive down the amount of movement, to then drive down the number of cases. And I would just make the point that if there was a resistance or an unwillingness to make these really difficult decisions, you might get some small economic benefit right now. That won't be worth very much if these restrictions have to stay in place much longer than they otherwise would. Every day that we can't reopen, that's the context in which you have to weigh up any sort of marginal economic benefit right now. The bigger play here is to get this done, get these numbers down, and then reopen, as obviously cautiously, but reopen as much as we possibly can, and then find that rhythm and find the COVID normal that will see much more economic activity. So I'm not for a moment standing here saying to you that business are happy about this. They're not, I'm not, workers are not. This is not the position that we wanted to find ourselves in, but the reality of the challenge we face, a greater challenge than we've perhaps ever faced, is that we have to make these tough calls.
Given that former Justice Code yesterday said there's no general restriction or prohibition which would prevent a person from commenting publicly on matters which are the subject of the Board of Inquiry, can I ask you, when were you first notified of issues with the hotel quarantine system?
Simon, it's not a question of being legally prohibited. No one's ever asserted that. I'll make a couple of comments and hopefully deal with this issue in broad terms. I'm accountable, because of the job I have, I'm accountable for any mistakes and all mistakes that are made. I've never shirked that responsibility. I've never moved so much as an inch away from that responsibility. That is the role that I have. I will own those errors. I will be accountable for those errors. So please don't be in any doubt about that. And no Victorian should be. The question about why was an inquiry set up, because I don't have those answers. I have not read through the 100,000 pages of documents that have been provided to Justice Code. I have not gone and conducted a judicial inquiry myself into myself. I don't think that's an appropriate way to go. There should be a distance. It should be at arm's length. There are answers needed. Mistakes have been made. I'm determined to get those answers, and I think the best way to do that is to have an arm's length process.
Surely you can say the answer to my question. When did you first know, what date did you first know about issues with the hotel quarantine program and the fact the virus got out of there?
Sorry?
And the fact that the virus got out of the hotel quarantine system into the community.
When the Chief Health Officer stood here, as did I, and reported that genomic sequencing data had clearly shown that at least a significant proportion of cases could be traced back to hotel quarantine. That's the answer to your question. Hang on. In terms of challenges with hotel quarantine, there were a number of outbreaks in a number of different hotels, and I would have been made aware through outbreak reports and through other reports along the way. Beyond that, though, the issue of it getting out, as you put it, Simon, that's when that was confirmed, and the first I knew about it was the morning that Brett Sutton and myself confirmed for you that we had that genomic sequencing report, and that B, we were setting up a judicial inquiry to get to the model.
Will you now release that report?
Hang on, everyone will get a go.
Release that genomic sequencing report?
The genomic sequencing report is not a document that I hold. It's not a product that I have.
Haven't you? Is it the government?
I've been briefed on it ahead of the press conference hours later, where we made it clear that the results of that genomic sequencing, and we also made it clear that we would establish a judicial inquiry in order to get the answers.
Isn't now the time then to articulate what's in that report, given what former Justice Coates said yesterday? Now, today's the day, surely.
Well, again, I'm happy to speak with the public health team about what data they have. The sequencing reports are done over time. They're not done in real time. They do take longer than it takes to do a test. I'm more than happy to speak to them about what, if any, or any information that can be provided, all of which, of course, would be provided and has been provided, I think, to Judge Coate in her important work.
Hang on. The important point of principle here is that you know the answer. The former Justice has said there's no legal impediment, so surely today's the day to just tell us exactly what's in it.
John, if I can put it to you, I don't know the answer. That's why we're having a judicial inquiry.
No, but you just said...
No, I don't.
Well, hang on. You just said that you knew what was in that you were briefed on it.
Yes.
So can you please articulate what you were briefed?
I was briefed, and I stood here and reported to you that a batch of testing, a batch of genomic sequencing, demonstrated that at least a significant portion of cases had come from hotel quarantine. It's what I said then, it's what I'm saying now. I have no further advice beyond that, and that's why when we've been asked that question, we have remained consistent, that we still believe a significant number.
Can we lock that in? Because it is the department that holds it. We've confirmed that it's the department that holds it. Can you release the most up-to-date genomic sequencing report
What I'm
data?
saying to you is that I would need to speak with the people who do that testing and hold that data. I've not received any further briefings since the initial briefing. I'm more than happy to follow that up for you.
You must have the document that you received originally to be able to draw those conclusions. Surely you can release that document.
No, I'm sorry, Rachel, I don't have the document. I don't get provided with detailed genomic sequencing reports. What I get provided with is information from the Chief Health Officer, who confirmed for me that at least a significant portion of those cases had come from hotel quarantine.
Information, just the briefing that the Chief Health Officer
That's exactly
gave you
that's what I've said to you, and what was said on them literally hours after he had received that report. That's exactly what was said at the time. It's exactly what I'm saying now. I just again make the point, I'll be accountable for mistakes that are made, but if I don't have the answers, that's why I've set up a proper inquiry to get those answers. We're all entitled to them. No one is for a moment anything other than completely clear. We need these answers, and that's why there's been a process set up.
When were you aware there was a major...
Well, we can all talk over each other, or we can just do one at a time. So Raf, and then we'll go over to this side.
Do you know the answer to who was supposed to be training the security guards? Like, do you know which government department had oversight for their training?
I think there are multiple agencies that had oversight. Again, this is the key point. If I were to conduct an inquiry and then present my findings, I think you would rightly be critical that should have been an independent process.
If it's clear to you which department had the sort of lead role with that.
It is not clear the lines of authority and accountability and exactly what has gone on here. It is not clear. That is why, despite some of the commentary, I just want to be clear with you. I set the inquiry up, so I'm fairly well placed to tell you why I did it. I don't have answers that I am satisfied with. There are questions that cannot be answered, and the appropriate thing is to get those answers. And then, regardless of what those answers are, I will be accountable for those answers and for any errors, any mistakes that were made. That's the job that I have. If I could answer all of those questions, and many more that I'm sure you would like to put to me, then I would. And we wouldn't need to have a judicial inquiry. It is an inquiry in every sense that is about giving us the clarity and the certainty and the answers that every single Victorian is fundamentally entitled to.
Were you personally reluctant to have the police overseeing the security guards?
No. Do you know who made that decision in the end to have security
No, in
guards?
terms of exactly who has made decisions at an operational level, they are some of the questions I simply don't have the answers to. And it is appropriate that we have a process to find those answers and then to come forward with them. And I'll just again make the point. Judge Coate has very broad terms of reference, a whole working life's worth of experience doing this important work, and she has the budget and the time that she's asked for. I have made it clear, anything that she needs, she will get, because we need the answers to these questions, and I'm determined that we will get them. But I would hope that no one was in any doubt about the fact that I fully appreciate, given the job that I have, that I am accountable and responsible for mistakes that are made. I've never moved away from that, nor will I.
So at what point were you first made aware of concerns about the operation of the hotel quarantine system in Victoria?
There were a number of outbreaks. I'd have to come back to you in terms of the exact dates, Lundy, but there were a number of outbreaks. There were some reviews that were conducted, some work that was done, and I would have been made aware along the way of cases. I would have been made aware along the way that there had been infections and that various steps had been taken. I don't think anyone had a sense, certainly I did not have a sense, that we were heading towards a situation where genomic sequencing would confirm that at least a significant number of cases had come from that setting. Beyond that though, I think the sheer volume of paperwork shows you this is a big system, it's complex, there are many questions that cannot be answered. I'm not prepared to settle for that. What I am about doing is getting those answers and then making sure that they are provided to the Victorian community and provided to you, and there will come a time when we'll be able to speak in absolute detail about those things, because Judge Coate will have provided those answers for us.
So is it March, April, May? Like when are we talking?
Again, I don't want to give you a date that I then have to correct. I'll come back to you. But again, I think it would be wrong to assume that I'd been briefed about the problem that we've all ultimately become aware of. That's really only become well known to us when that genomic sequencing report the briefing was given to me by the Chief Health Officer. That was pretty early on that morning when we stood up here and confirmed that for everybody, and I confirmed that a judicial inquiry would be set up, and I think it was only days later that the work of the judicial inquiry started.
Premier, you were opposed to the army.
Premier.
And who knocked the army back then?
Well, I think, John, one of the things that will be tested out of this is exactly what was on offer. The ADF have provided transport support in a number of other states, not all states. Security guards have been used not in all states, but not just in our state. All of those matters, that'll be tested. And if I could stand here and provide you with all of those answers, I absolutely would. But there are many questions that I simply don't have the answers to, and that's why we've set up, no more, no less. That is why we have set up a judicial inquiry.
Sorry, were you advised early, though, whether the police should get involved and oversight, or corrections department, or the ADF? Did anyone advise you in the early days that this should happen and this was the way it should work?
No. There's a decision to establish it. It then gets established. It's then run by multiple agencies, and beyond that, we can't be certain, we can't be sure, we can't answer many of the very important questions, and that is exactly why we have asked Judge Coate and Counsel Assisting and all the others who will support her to give us those answers. We're all fundamentally entitled to those answers. I will be accountable for those answers and any mistakes that were made. I'm not for a moment suggesting otherwise, but I'm not. I just want to be very clear with you. I cannot conduct a judicial inquiry from this podium while there is another judicial inquiry being conducted. I can't be any more clear than this. We don't have answers to many very important questions. It is appropriate to get those answers. And I just hasten to add, the program has been suspended. To the extent that it still operates, not for returning travellers, but for instance, people who might have been in a public housing unit and needed to move out to protect their family, it has been completely reset. Corrections Victoria, with some support from Victoria Police, are now running the program, just in case there was any sense that we couldn't wait until Judge Coate's report. We absolutely can, and because we don't have those answers, we have no choice but to wait until that report is brought down.
It seems incredible, though, Premier, that,
it'll be a long press conference if everyone tries to ask the question at once. So why don't we go Rich and then Nick and then Alex.
Are you saying that the Crisis Council of Cabinet didn't have any role in making these decisions about ADF troops, police in quarantine?
I'm not saying that at all.
But you're part of that Crisis Council, and you're saying you don't have the answers. Isn't that ultimately what this body was set up to do, make decisions?
The answers as to the operations of this scheme on the ground, any variation between one provider and another, all of those issues. We have not, as a government, gone and conducted a detailed inquiry. We have instead asked a judge at arm's length from us to do that work. Now, I could understand that there would be some urgency to us trying to find those answers if we were still receiving thousands and thousands of people from overseas. We are not doing that. And I took the decision, a difficult decision, but it was the right one, I think, to suspend that program. We have a very small number of people who need to quarantine, and we are supporting them to do that. And I want to assure you and all Victorians that that scheme has been much smaller, but it's also been completely reset and is under the auspices of the Department of Justice, Corrections Victoria, with, where appropriate, police support and indeed health support where that is the appropriate thing as well.
Clarify, my question was about, weren't these decisions made by the CCC, and you're part of that?
Well,
wasn't the decisions about police and ADF made in that meeting?
What I am saying to you, exactly who delivered these services and in what circumstance, those matters need to be dealt with by Judge Coate to give us the answers we need. That's the process that we have set up. I'm not, please don't take from anything I've said, I'm not trying to do anything other than assume responsibility, ultimate responsibility. That is my job. But in terms of the detail of exactly who made decisions at a very localised level, how they were made, how processes worked, whether there were proper safeguards in place, all of that detail, that's for Judge Coate to examine, and I think she will do that without fear or favour and at clear arm's length from the Victorian Government. There would have been an alternative approach where I might have asked the Secretary of my department to conduct that inquiry. I don't think that would have been an appropriate way to go. This is a very serious matter, one for which I am ultimately accountable, but we need to get these answers. If I had them, Rich, I would provide them to you. I simply don't. That's why we've set up a process to get to the bottom of what's gone on from A to Z. Simple as that.
It just seems incredible, Premier, that during the early debate about this,
yes,
in Cabinet and beyond, that no one raised the prospect of police, ADF or the Department of Corrections taking control of it or giving it appropriate oversight. It just seems incredible that wasn't even suggested.
Well, the oversight arrangements, their adequacy or otherwise, are matters that Judge Coate will go to directly.
Said,
well,
we should do this.
Well, Nick, the important thing was to establish the program, to set the expectations as to how it would run. The detailed arrangements are not something that would necessarily be considered at great length by Cabinet, but ultimately, these are matters. Exactly what has gone on here is the subject of a judicial inquiry. The reason for the inquiry is not for the avoidance of scrutiny. It is for absolute scrutiny. And I don't know that I could be any clearer. I'm not sure how many times I've said...
But the police minister is part of that special cabinet. Well, she didn't raise, why don't we use the police?
I'm not conducting this inquiry. I am not conducting this inquiry. Judge Coate is. And nor am I going to simply... Hang on a minute. I am not going to seek to provide you answers to questions that I simply don't have. It is appropriate for Judge Coate to do this work, and that's why she's been tasked to do it.
To matters that you've said on the record that you're happy to answer. So you've said it's already on the record, a significant number of cases that came out of the hotel quarantine.
At least a significant number is the term that's been used by the Chief Health Officer
and you're saying that
myself.
And the buck stops with you, you're going to take all responsibility of what comes out?
It's the job that I've got, Alex.
So does that mean that you're already accepting that decisions that were made by you and your government have led to, we're talking dozens of deaths now? Your government is responsible for those deaths.
How you term it and the commentary you want to put on it is a matter for you. What I am indicating to you and to all Victorians is that there are many questions. We do not have the answers. We need a process to get all of us those answers, every single Victorian. That's what I've established. That's what is currently doing its work. And it will provide a full and frank report. I, as the leader of the state and the leader of the government, I will be accountable for errors that have been made, for mistakes that have been made. I will be accountable for the findings that Judge Coate brings down. I don't know, Alex, whether I could be any clearer than that. That is not anything more or less than I've said a number of times already on this issue. That is the nature of the job that I have.
Police or ADF involvement was recommended by National Cabinet. Surely that was discussed in the Crisis Council of Cabinet, wasn't it?
Exactly what was recommended by National Cabinet will be something that I'm sure Judge Coate will go to, because I don't know that that's
necessarily
an accurate statement.
Can't you acknowledge that was said?
I'm not acknowledging what I think might not be necessarily an accurate statement. ADF
statement. What's true about ADF?
Provided transport support in some states. I think the suggestion that the ADF were running hotel quarantine anywhere, I don't think that is accurate. But again, that's not for me to judge. That is something that Judge Coate will look at and provide us with as much clarity as she can. Again, as I've said to you a number of times, the inquiry is not established to avoid scrutiny. It is so we can get the answers we need, all of them, and the answers that we are fundamentally entitled to.
Curious about what modelling you're okay having the Health Department release. You've spoken about the stuff that you and Brett Sutton spoke to. Are you okay with that being released? And if there is later genomic sequencing that I've been told points all to one hotel and not to just the Ridges and not the Stanford, are you okay with that being released to the media?
Yeah, sure, Raph. Look, if there's any sense or any suggestion that there are, boxes of genomic sequencing reports and I'm not letting them be released, that's simply wrong. I get briefed on the results. The one briefing I think I've had is the one that I stood here hours later and took everyone through. I don't do the genomic sequencing. The genomic sequencing is samples and batches of cases. It's not necessarily every case, at least that's the understanding that I have. They're not conducted by, I don't do that work. I'm happy to get advice on what's possible to be released. Again, having stood here only hours after I was first briefed on this issue, I would hope I had demonstrated to you that I'm prepared to front whatever those results are. And again, that'll be something that goes to Judge Coate to look at. It'll be one piece of material she looks at amongst, I think with the tally is something in the order of 100 and something thousand pages, which I freely concede I have not read. They've been given to a judge to look at, not for me to read, and in essence, grade my own paper. That's not the work that's not what I'm doing. I'm focused on fighting the virus, which is exactly what we have to do now.
There's two other issues on fighting the virus.
So Raf and then we'll...
If I can. I asked 2 Sundays ago, just for a workplace breakdown, just,
Yes.
you know, the numbers of positive
Yes.
cases across workplaces. It'd just be great. I think that would help people have an
Sure,
understanding
I'm
of the
more than happy
virus.
to chase that up.
And a really important question for today. There are tons of people calling radio stations, newspapers, online. I've tried the hotline. I've tried the website. I don't know what my business is supposed to be doing tomorrow and Saturday. What do you say to those people?
What I'd say is that I think the Department of Jobs call centre has got 4 times the number of staff, and it wasn't 50 staff to start with, so it's hundreds and hundreds additional staff. DHHS, I think, has got a similar scale up. There is an enormous amount of people who are trying to provide as much information as possible. I would just appeal to Victorian businesses, workers, all Victorians. I know this is not easy. I know it's very complex and challenging. It is unique. We've never done it before. It cannot be made perfect. It will always be, to a certain extent, an imperfect process. But just to give an example, there's been 17 roundtables in the last 72 hours. There have been, with different industries, there have been literally, we've lost count, hundreds and hundreds and hundreds, maybe thousands, in fact, of phone calls and Zoom meetings with employers large and small from every industry and from every part of the state. Everyone is doing their very best. This will settle. Of course, whenever the deadline comes in, the immediate aftermath of that, there will be some confusion, there will be some challenges. I fully understand that. We'll get people the clarity that they need as soon as we possibly can. But any challenges here are not for the lack of effort. It's simply because it's completely unique. We've never done this before, and no matter how hard you work, no matter how long the transition period was, there will always be, as I've said a few times, if you draw a list, there'll always be debates about who's on it, who shouldn't be. When you draw a line, there will always be debates about who's on either side of it. It is challenging, but there's a big team, a very big team, and they're all doing their level best to try and provide people with the information they need. And I think it will settle in coming days. And I just want to assure people, compliance is very important, but Victoria Police understand that this is a massive shift. It is a massive shift. It's not something we've done before. And it will settle, and we'll do everything we can to make sure that it does.
How frustrating was it for you to hear about what went on inside these hotels? Security guards spoke out about some of them sleeping with guests, taking guests out on shopping trips. What was your reaction?
It's not for me to determine what has gone on in these hotels. That's for Judge Coate.
How do you feel?
Well, again, this is not about my feelings. This is about my work. Well, you are, and I'm indicating to you that it's not about my feelings. It's about my job, and my job is to get this done. And that's why I've had to make some very, very difficult decisions. I'll tell you one decision that wasn't difficult, and that was setting up a judicial inquiry to get to the bottom of this. I want these answers. I will be accountable for these mistakes. But it is not for me to sit in judgment of myself or my colleagues. That should be done at arm's length, and that's exactly what's happening.
Premier, hotel quarantine was done with great haste through necessity, and we've seen the results there. You've just said that these stage 4 restrictions are unique, never been done before, it's been done in a great hurry. How can Victorians trust that something won't go wrong now
It's
as
done in
well?
a great hurry. I'd say that it's been done because there is a sense of urgency here. This virus, the sooner we act, the sooner we will limit movement. The sooner we limit movement, the sooner we will drive down these case numbers. That is the advice of the experts. I think the alternative, I suppose, James, would be that over the course of the weekend, I get provided with advice from the experts to take certain steps, and I say no. I don't think we should do that. I'm not going to do that. That's not the way this should work. It should be make the tough calls. That's what I've done. It's not a position we wanted to be in. It's by no means easy, but I think things will settle in coming days. And I'm very grateful to all of those who've been working so closely with us and working very hard themselves to make sure that we can all make this work. If we had an alternative, if there was another way, then of course we would pursue that. But the experts are telling us, unless we limit movement, unless we drive down the number of people that are moving around the community, we won't drive the cases down.
I'm disputing the decision, but you've just described the hundreds, maybe thousands of phone calls that have happened in the last 72 hours. How can people trust that it's all going to work out all right?
Well, this is not about outbreaks, though. This is about making decisions to try and, that's exactly right. So, well, I'll boldly predict there'll be further outbreaks and there'll be further positive cases. This is not a binary thing. It's not an absolute thing. This is about doing everything we can to limit the number of cases and drive them down. I wouldn't see the level of hard work and the level of activity, I wouldn't see that as something to be critical of. I think that there's a big team and they're doing everything they possibly can. I'm just trying to acknowledge that I know it's painful, I know it's difficult, but it's never been done before, which means that the notion of landing an absolutely perfect outcome that won't need to be tweaked and altered and modified potentially over the next few days, I think that it would be foolish to think that you could get a perfect outcome here. It is complex.
I'm not talking about tweaking, Premier, I'm talking about catastrophic failure.
Well, I don't accept that. These arrangements have been in place for only a few hours, and I think that if all of us work together, we'll be able to deliver the desired outcome, which is less movement, less cases, driving this down and then being able to open up again.
Do you concede your government's credibility and your ability to sell the tough stage 4 restrictions have been impeded by the problems with hotel quarantine?
That's a matter for others to judge. I'm not going to sit here and be a commentator on myself, Nick. I've got a job to do. This virus doesn't stop, neither do I, and I won't be stopping. We will deliver this strategy with the help of Victorians and a massive team of people to whom I'm very, very grateful, and all those Victorians who are doing the right thing, which I think is the overwhelming majority. I am proud and grateful that people are working with us. This is the only option we have, the only alternative, and it is through this strategy and over these next 5 or so weeks that we'll be able to drive these numbers down.
There was a rumour yesterday afternoon that Brett Sutton had quit. Can I just put it to bed completely? At any point has he offered his resignation, or are you at any pains to say where that came from?
He's having 3 days off. Nothing more, nothing less.
Has there been enough support provided in terms of kindergarten for, say, single parents who aren't considered permitted workers who are now going to have to effectively stop work to look after their children? What sort of support is available for them?
Well, look, there are very large sacrifices that are having to be made by lots of different people across the community. Vulnerable children, children of permitted workers, kinder and childcare is available. In-home arrangements, if they're existing arrangements, they can continue as well. There's no permit required for a family member, for instance. You could take a child to a family member to be looked after while you went and did other things, again, all in accordance with the rules. That's all you could do, though. It's just a matter of drop off and pick up. We're trying to be as flexible as we possibly can, but the challenge here is that if, as I said yesterday, if every industry leader or every employer or every family that had put to me a well-argued, impassioned, logical case, if I'd said yes to all of them, then we'd have more people at work today than we had under stage 3. Now, we could do that, and that might deliver some economic benefit right now, but that will pale into insignificance once these restrictions have to stay on, not for weeks, but for months, and we just don't get to reopen again. I'm happy to follow up on the specifics of that case. I will have some further announcements to make about mental health, both mental health in the broad context and also mental health and support for younger people. And we've been working on that closely with the Commonwealth. I've had some contact with Pat McGorry this morning. I've had some numerous contacts with the Prime Minister overnight and again today. And we'll have more to say on that counselling and support, which I think is probably at the centre of your question. There is more we can do there because we're moving into a new phase, and I'll have some more to say about that soon.
Actually accepting children without a permit?
Sure. So we'll go.
Just on childcare, you mentioned in-home care, Premier.
Yes.
But your office last night contacted us to say only in-home care allowed for permitted workers. Is that not correct?
That is absolutely correct. So if you...
Why would that be? If someone already has in-home care for someone, for a child,
Yep.
and that's been going for some time, why should that not be allowed? All
because we can't continue,
trying to keep their job and
because we can't continue to have the amount of movement that we have had. We cannot continue, any of us, to think that unless we make profound changes, that will deliver less movement, less contact, that we have any chance of having lower case numbers. We simply don't. And look, if there were a different way, if there were a different setting, if the advice were different, then we would follow that advice. We've always been guided by the advice of our medical experts, and I just again say that the public health team in Victoria have looked at this incredibly carefully, just for that sort of second opinion, third opinion to validate their thinking. We've had detailed conversations with the Commonwealth as well, with Brendan, with Paul and others, to try and make sure, and I'm sure Alan and his team, Brett and their team have spoken to other CHOs in other states. They may even have gone as far afield as to speak to public health experts in other parts of the world based on some of their experiences. It hasn't been done quickly. It's been done methodically. It is in their judgment the only option. And when presented with advice like that, then my only option is to then try and to make practical, to actually deliver on their advice. And again, I make the point that when you're doing something that's unique, you're doing it for the first time, it's never been done before, it will be imperfect. That's why we have a preparedness to give people time for these arrangements to settle. That's why we also have a preparedness to make some changes if we need to. So I'll give you an example. For instance, I announced on Monday that the poultry, for instance, would be going down to 2/3. They then came back, that was our aim. They then came back to us and said, look, these will be the consequences. You'll have all these hundreds and hundreds of thousands of birds that'll have to be killed but not processed. They'll finish up in landfill. That doesn't make any sense. So we've gone to 80%. We've got life cycle of beef and others is longer, so you can wait a few weeks. We've got some discussions going on with the flower industry at the moment. So flower growers who, if the wholesale flower market were closed because it's not food, then they'll be ploughing back into their fields, into their paddocks, or upending their greenhouses. Again, is that something that we can tolerate? There's literally 1,000 of these examples, and we're working, so maybe they're good examples or not, I'm not sure, but they're the ones that came to mind because there's a lot of them. We are working through each of those painstakingly, methodically, and there will be changes, and they'll be the best judgments that we can make. But I can indicate to you that we can't make all the decisions we might like to make, because that will simply mean we have as many or even more people moving around the community rather than less, and that'll just mean that these cases remain flat or maybe even go up further, and that's not what we want.
Childcare centres are not.
Childcare
centres are actually letting people drop their kids off this morning who don't have their proper permits in place. Is that acceptable?
Oh, look, I wouldn't be critical of anybody who might not necessarily, given it's only hours after, it's the first morning after. I wouldn't be critical of people. I'm sure there's been best efforts made, but there will be a time, and it'll be fairly soon, where that door will shut and people having been given a reasonable amount of time, they need to transition. But again, I wouldn't be critical of people. It is just the first morning of what's going to be a long haul, and I think some common sense is always important. We're going to go over here.
Brent, was the man in his 30s who died yesterday a resident of a disability care home?
Look, what I'd say to you is we have a practice of providing gender and age. Beyond that, I think we do run the risk of essentially identifying the person. That may be appropriate, but that's not my call. It has to be that person's family, that person's next of kin who would make that judgment. Let me make some inquiries with the family. I'll get someone to have a discussion with the family, and if there's any more information that we can provide to you, we will.
Disability care operators are saying that they are worried not enough is being done to protect people in their homes and staff as well. What can you say to them and to the public that you're doing to prevent an aged care type situation?
Whilst I don't have a detailed announcement to make today, and I won't try and recall all the different steps that we've taken, but we have done, both Luke Donnellan and his federal counterparts, myself, the Prime Minister, we're working hard to make sure that we keep those settings as safe as possible. I'm more than happy to come back to you with some of the detail of the different steps that we've put in place. I think there are many settings where people are vulnerable for one reason or another, and that is one setting, albeit within the disability framework there are lots of different places, lots of different settings. It's not just one static thing, but if I can get you, in fact I will be able to get you some further information and we'll get that to you as soon as we possibly can.
Some of the aged care operators, Premier, can some of the aged care operators be charged under industrial manslaughter laws?
That's not a matter for me. The Director of Public Prosecutions and Victoria Police would be the arbiter of those matters, and I don't think you want a situation, I've said this a few times along this journey, you don't want the Premier telling police who to fine, you don't want the Premier telling prosecutorial authorities who they should prosecute. Those matters are separate from us, and that's the way it should be. On the coronial inquiry, on the notion of police investigating these matters, again, that's at arm's length from the government. They are very important matters to be dealt with, and His Honour, the Coroner John Cain, will look at those matters, I'm sure.
Sorry.
We're okay, we can
Given
keep
the amount
going.
of mixed messaging around how processors will reduce their operations, do you accept that's been unhelpful to processors and their staff?
No, I don't, because I don't think the messages have been mixed at all. We had a number of questions.
Today you're giving further clarification on different industries.
Well, I don't think anybody in...
1/3 of last week, not 1/3 of the last month, or staff over 3 months.
No. 1/3 of their July level, or a third less than a 3-month period, a continuous 3-month period at another time in the year. I think that aligns pretty closely with what I said. And just for the point of clarity, I don't think anybody in the poultry industry is upset that they're going to be at 80% and not at the 66% that I said. So I don't think there's been any confusion there. It's a challenging thing, as I've said. I think I've made the point pretty clearly that this has not been done before. It won't be perfect. I'm grateful to those who've worked with us. They've done a great job, and these changes, as regrettable as they are, will maintain the basic supplies that we need, but drive down the number of people that are going to work, and that's the only way that we can drive down cases.
Can we just get an update
People won't be able to get the same cuts of meat they always get. Does that, given the way supply works, mean that people should expect to pay more for their meat?
Well, pricing is a function of the market. I'm not going to try and give you a prediction on grocery prices. What I'd say is that there are buying limits that have been put in place. That'll be something that's constantly monitored. There'll be, we'll have line of sight of that. I've been very keen to make sure that we do. Beyond that as well, we're in very productive discussions with the supermarkets about making sure that they balance the obligations they have to consumers no matter what postcode they're in. So there are different settings in regional Victoria. We want security of supply for regional supermarkets, for supermarkets in the west of Melbourne, supermarkets in the inner city, supermarkets in the southeast. There is an obligation that's broader than just profit, and that's not a criticism. I want to take this opportunity to thank everybody in the supermarkets, all of those in the distribution centres, warehouses, people stacking shelves, all of those who actually supply supermarkets. They've done a fantastic job. One of the ways that we reduce workforce, for instance, is to have a lot of product go direct from where it's made straight into supermarkets rather than going through big warehouses, which mean that's less people that need to be working, less people that need to be moving pallets around, loading and unloading trucks. So pop-up DCs as well. There's all sorts of different things that the supermarket sector are doing with us, and I'm very grateful to them for it.
There's a lot of confusion.
Contact tracing.
Yes.
You know, this idea that you're going to contact every positive case
Yes.
every day.
Yes.
Do we know what percentage you're at, and whether or not that's phone call, message, or door knock?
I'll come back to you on it. Look, to be honest, completely frank, I haven't got an update today on where ADF door knocking is up to. My last meeting, which was a marathon effort, 2 nights ago, had us at very, very close to 100% within 24 hours. And ADF were moving through all, in the first instance, anybody that we couldn't contact for whatever reason. That's then been expanded that they're door knocking all positive cases, and as the numbers build up, as you know, we've got a request, I think 500 plus additional ADF. We're going to match that with the authorised officers from our show, and they'll move to door knocking close contacts as well.
But is that the initial contact is a door knock, and then every day after that is a phone call?
Well, no, for some people, the initial contact will be ADF and a health department official knocking on the door because they didn't answer the phone. For other people, they'll have the phone call, they'll have the long form interview. For close contacts, there's a phone call, there's text messages, there's all sorts of things that happen with them as well. But ultimately, we're going to move from just the people we couldn't contact getting an ADF door knock, everyone's going to get door knocked. And that's, I just want to say, in case anyone thought that was heavy-handed, although I don't think too many people do. I think people are frustrated that there are some people who weren't doing as they should be doing. But we'll soon pull that up because we're knocking on their door, and if you're not there are substantial penalties. But it's not just about compliance. It's about saying, okay, this is what you've got to do. Are you 100% clear? Do you know, you've got all the details you need? But also, what can we do for you? Is there something that you need? And we've filled, I haven't got a tally, but we've filled a number of scripts. We've gone and got shopping for people. That's all of those things. On ADF, I'm happy to get you an update.
Contact with every positive case every day, because at some stage there was a text every day. So are they getting a phone call every day, or after the initial contact is it just a text?
Let me come back to you on that. In terms of not every person will be door knocked every day. No. They'll be door knocked, and then there'll be multiple door.
Conversation every day. I think that was Greg Hunt, the Federal Health Minister, was saying every contact every day, and I'm just not clear if that's a conversation every day or a text message every day.
Let me come back to you on that. Given that it's not just 1 day, it's 14 days, so I would need to get some details on it.
Have fresh figures on door knocking, Premier?
No, I don't, but as soon as I get them, I'm happy to provide them to you. I know, I'm sorry, I did commit to try and get you an update, but I simply haven't had time to speak to the ADF public health team.
Just an update on the amount
Let me confirm, we'll make it a feature of tomorrow. How does that sound? All right?
Premier, can I please get an update on the number of people that have been fined for not isolating? Because last week we were told 1 in 4 people weren't isolating.
Correct.
Monday we were told 800 people weren't isolating.
I think
how many have been fined?
I may have been inadvertently apologising to you as well, because until I get the ADF number, I can't give you the number of people that weren't.
I have asked for 3 days ago.
Well, you have, and let me be really clear with you. I'll get you an answer as soon as I can, but I'm not going to pull police off door knocking or investigating so that I can put a tally forward. As soon as I can get you the data, I will absolutely do that.
My question, the reason I ask so many times is I just doubt it's that high. It's how many of the 800 people have actually been fined compared to when the ADF came knocking on people's doors. Was it because they had the wrong address, or were people actually out exercising or breaking the rules?
No, we've been very clear about, okay, well, let's go, but we'll deal with the exercise issue then. Let's be very clear. I don't think that exercise has contributed to the spread of the virus, but it's about enforcement. If you're going to enforce this and you're going to have a fine that's substantially higher, then people can't have any lawful reason to leave other than, say, emergency care or fleeing family violence or something that can be proved, something that can quite easily, it's either true or it isn't. That's why the change to exercise was made. I've tried to be pretty clear. If you've got 20%, 10%, whatever the percentage is, of people who couldn't be found, not all of them will be doing the wrong thing, and I think I've said that a few times now. There'll be some people, of course, where we have the wrong address. They've given us the wrong address. Or they're isolating somewhere else. They've gone, they're doing the correct thing. They're just not doing it at the place we think they should be ordinarily found. As soon as I can get you further information on that and what's happened, I'm more than happy to do that.
Thank you, because I just want to be really clear about how many people have actually been doing the wrong thing. So do you think we'd be able to get a number tomorrow or at any point this week?
Well, I can't give you the results, but because that's the work the police are doing. But as soon as I can tell you what the picture is, get you an update, I'm absolutely happy to do that. Hayley from my office, she's sitting right at the back there, and she'll be happy to chase that up. She has a long list of things to chase up. Her list just got longer. There's no argument between us. I want the data too, but they're doing their investigations, and I think that is that's where they should be focused. But at some point, we will collate it and we will present it to you. Tomorrow's commitment, and I've been pretty good every time I follow up. Sometimes I do it from here, sometimes the staff do it. I'll get you an update on ADF door knocking, authorised officer door knocking, and anything else that you want can go into onto that list.
There's a lot of confusion regarding tradings.
Yes.
Have there been guidelines set for who and how they move from site to site? And
Yes.
do you think the industry will be ready to go midnight Friday or Saturday?
I believe they will be. Again, I have made a few points. It's not a criticism. It's just I think trying to make an obvious but important point. If you set a deadline, people work to that deadline. So yes, there'll be a few challenges in the hours directly after that deadline. But what we want to try and achieve is no more than 5. And if there's movement that's unavoidable, because, for instance, it's specialist trades, and once they've done the job there, they need to move somewhere else, and they're not going to wait 6 weeks before they move to the next job, we want to do that safely, and I'm confident that we can do that. In terms of maintenance in your home, if you've got a tree falls over, you can call someone to do that. If a pipe bursts, you can call someone to fix that. All of that's a different issue. But in terms of movement,
just want to know are there specific guidelines as to who can move from site to site?
Yes, and there will be. That's, I think, right off the top. I mentioned that there were detailed plans, COVID-safe plans that will be released. This might come in stages. There's certainly additional information that we'll be able to provide you along some of the announcements I've made or some of the update I gave you early on around meat processing and things like that, warehouses, construction. That'll be a bit later on this afternoon. And if there's further updates that we need to do, then of course we'll provide you with that also.
We've had reports from Uber drivers that some people are going to get tested in Uber drivers. They're taking Ubers to go get tested. Is that something that you're concerned about? Are there rules around how people should be getting to these testing sites?
Well, the most important thing is that people get tested, but if you've got symptoms, you need to make sure that you're coming in contact with the smallest number of people possible while you get tested. And certainly coming in contact with nobody between your test and when you get your result. The assumption has to be that you've got it. Perhaps that's one of the examples why some of the changes we've made in commercial passenger vehicles, regardless of which company runs them, masks and things of that nature, I think was, and passenger limits and things like that, was the right choice to make. I've not made those calls. That's based on detailed consideration by the public health team. You're going to go up the back, yes. Sorry.
A false sense of complacency to people, but the next 6 weeks is going to be very tough.
Yes.
Can you provide people with some hope? Are we going to have no cases at the end of this? Are we going to be down to single digits?
I would love to be able to predict the number of positive cases that we would have tomorrow, and I'd certainly love to be able to predict where we're going to be in 6 weeks' time. That's not the nature of this virus. The only thing I can predict is that the virus won't stop. Neither will I, neither will the team I lead. We will do everything we possibly can with the cooperation and support of Victorians to drive these numbers down. That's the commitment I can give. I can predict no more than that. Other than, I suppose, to say, if people don't follow these rules, if we don't all accept that we're in this together, whether we like that fact or not, we will not drive these numbers down. These are very difficult decisions, and today is a tough day, one among many. But this is the only way we will drive down movement and therefore the number of cases and therefore get to the other side of this. Trying to predict where this wildly infectious virus will be in a day, let alone in 6 weeks, is really tough. But the experts tell us if we follow these rules, if we see this through, then we will drive these numbers down.
55 people fined for breaking the curfew. Overall, have you been happy with how it's been working? Has it been doing what it's supposed to do? And I guess what would you say to the 55 who have...
Well, I would hope that... Well, I'd make the point. You didn't need to be fined. You could have made a very different choice. You chose not to. That should be a lesson to anybody else who thinks they can gamble with not getting caught. If you breach the curfew, you'll be caught, you'll be fined, and the fines are significant. If you breach the curfew again, then it won't be $1,652. You know, you'll be dealt with appropriately. So again, what that tells you though is that the vast majority of Melburnians are doing the right thing, and I say thank you to each of them. The curfew's there for a reason. It's to limit movement. It's to stop this notion, which we think was occurring. I'll just duck over to a mate's place. It's all fine. I feel well. That's what spreads the virus. The rules are there for a reason. They have to be followed. I know it's tough. I know it's difficult. But let me just give a shout out to Victoria Police. They're doing a great job enforcing these rules, and the curfew just makes that job much easier. There will be people who are out who've got to go to work. That's perfectly fine. You know, if you've got to go to the hospital you've got the urgent matter, well, that's fine. But the curfew makes it so much easier for Victoria Police members, and can I say it makes it easier for those who have to be out and are allowed to be out. They don't have to go through, that's where the permits are so important. It just means you're not having to tell your story 15 times, you're not having to have any sense of anxiety. You've got a bit of paper that says you're in the right, you show that to the police officer and you move on. That is a simple thing. We all wish we didn't have to have that, but it is a simple thing that I think works for both sides.
Hotel quarantine. It's now 2 months since you you revealed the genomic sequencing linking linking the breaches in hotel quarantine to the cases, you've said you're in charge, the buck stops with you, yet you're unable to say who was responsible for those decisions. Surely, if the buck stops with you, you can answer questions about the simple chain of command and who was responsible. And yes, there's a judicial inquiry and that will go to more details, but surely you can just answer simple questions about the chain of command. And if you can't say who was responsible for that, then that's a problem in itself, isn't it?
Well, Rachel, I think we've probably covered this ground, but I'm happy to go back over it again. I accept responsibility for mistakes that are made. I have a job to do. I'm exclusively focused on that. The judicial inquiry has not been established for the avoidance of scrutiny, quite the opposite. And I would have thought that was pretty clear. We don't have answers to questions we need answered. That's why we've asked an independent process, well-resourced, well-equipped, well-skilled, to go and get those answers for us. That is the appropriate thing for us to do. And then we will get those answers and we'll be able to have a much more fulsome discussion at that appropriate time. It's not for the avoidance of scrutiny. Nothing could be further from the truth. The alternative would have been no inquiry, and then I think you would be rightly critical of that. You would be rightly critical of that. In terms of chain of command and who's responsible, I think I've made myself abundantly clear today about the way I think that operates. It stops with me. I'm accountable. I understand that. I have every day that I've had the honour of having this job. I've never moved away from that, not 1 inch. I understand that to be the case, and that's why I've set up an inquiry to give me the answers that I want and that Victorians are entitled to.
What does accepting responsibility look like, Premier?
I'm not going to be speculating on those matters, Rich.
Was the decision to use security guards rather than police discussed in Cabinet or the smaller Cabinet that exists, and not at all?
Again,
The Minister didn't bring it up, Marty Pakula didn't bring it up at all, the Health Minister?
What was determined, how it was delivered, all of those matters are the subject of Judge Coates' inquiry, and as I've said to you, I think we're back where we were. I'm not sure how long.
You know the answer to this one. You actually were there. You were in the Cabinet.
Alex, I'm not going to conduct a judicial inquiry from this
I'm
podium.
asking you to discuss the conversation that you have with your ministers in Cabinet where you made the decision.
I've answered your question, I think, multiple times now, and I've made my position clear. I'm not expecting you to necessarily agree or concur with the answer I've given you or the position I've taken, but that's the position, and that position will not be changing. I'm not having 2 inquiries at once. We're having a proper inquiry. That's at arm's length, as it should be. We all have many, many other things that we need to be focused on every minute of every day, and we are. And the Judge Coate will take that inquiry wherever she wants to take it, and she will report whatever she believes is appropriate.
You can't say who was responsible for...
We're just doing the same thing,
if you...
If you're asking me a question, are we doing the same thing? The answer is yes, we are. And you absolutely can ask the Chief Health Officer. I've answered those questions. My answer's not going to change. That's a position. That is a position. I'm not wanting to be disrespectful in any way, but I have made myself clear, I think, and I'm not going to be suddenly giving you a different answer. But again, Rachel.
I was going to ask,
sure.
if you can't say who was responsible for these breaches 2 months after they happened, how can we be confident that we won't have a similar situation?
I didn't answer that when you asked me before. Rachel, the program has been ceased. There are no international flights coming to Melbourne. I think that answers your question.
Are still responsible for our entire response to the coronavirus crisis. How can we be confident that similar mistakes will not happen in future in other parts of the coronavirus response?
Rachel, everyone is working as hard as they can, doing their very best, and I think that there's an inquiry into a series of decisions, a series of practices, and the ultimate result. And it is appropriate that inquiry run its course. In terms of the broader confidence that the Victorian community can have, I would simply say the team is thousands and thousands of people. They are working night and day. They are following the advice of the experts, and with the support of the Victorian community, we will beat this thing. Without that support, though, without a sense of compliance and ownership and the acknowledgement that it's a collective challenge, it's something that we all have to deal with, then we simply won't, and numbers will be far, far too high.
Premier, if you're
responsible for this, do you think you should resign?
I think I've already answered that question. Rich just asked me a slightly different version of that question. I've got a job to do. As I've said to you a number of times, this virus doesn't stop, neither do I, neither does my team. I think I've answered that question. Alan, there's a question for Alan, I think. He's waiting. He's very keen to answer it.
Fantastic.
No pressure on the question. That's fine. Over to you.
Just something different, maybe. Alan, the 107 community transmission today, why do you think that's happening a month or so after we moved into stage 3? And what evidence do we have more than 2 weeks after we started wearing masks that that's cutting down community transmission?
Look, I think the comfort I'd take is that that's not going up. You know, obviously those numbers do go up and down. They do take a little while to be investigated and closed out. But you know, as I said before, we're not seeing 2,000 cases in total, and we're not seeing hundreds and hundreds of these unknown community transmissions. So we need to wait for the next phase to kick in, and that should start flowing through over the next week to 10 days.
How long after a case is picked up is it declared as community transmission? You can't find the source, and do you think that 107 is a function of contact tracing not working as well as it could?
Look, I think, so, I mean, it is an exhaustive process of doing contact tracing. It does take some time, and sometimes it requires going back to people to you know, confirm stories or to try and make a link with another case. But it does take a number of days, and it's not an instantaneous process. I couldn't give you exact times. Sometimes it takes longer, sometimes it's shorter.
How many of today's new cases are linked to known outbreaks? Do you have that?
No, I do not have that information here.
And I'm assuming that you don't yet have fresh numbers for St Basil's, either total cases or...
No, we'll get back to you on that one.
Death toll at St Basil's.
So I think there was a question.
So what's the death toll at St Basil's?
Oh, sorry.
Just the hospitalisation figures. Do you have the latest ones? How many people are in ICU?
Yes, I do. There are 575 people in hospital, and 42 of those are intensive care. I just note that yesterday we noted that a number of people have been transferred from residential aged care into hospital, so that doesn't necessarily reflect that they're all acutely unwell, but obviously someone in hospital is always a matter of concern.
What is the St Basil's death toll?
Sorry, moving back to St Basil's.
Sorry,
and goes to the point that you're making about those going to the hospital. There's reports today that residents from St Basil's will be moved from hospital back to the facility under the same management that was there when the outbreak began. It's one of our worst outbreaks that we've seen in the state. Are you comfortable that residents are moving back to an aged care facility still managed by the same people? Is that appropriate?
Well, I'm not sure that I can comment specifically on a specific aged care, but there is certainly a risk assessment that's done about when people need to go to hospital and when they can go back to what is their homes otherwise. So, and that's a matter for assessment. Just in terms of the question about exactly how many people at St Basil, I don't know that offhand, and we'll get that information to you.
Thank you.
Are we able to get a list of all the hospitals where healthcare workers have been infected with coronavirus? I don't think there's been a full list of the hospitals ever published.
Yeah, I think we'll see what we can get back to you. Yeah.
Alan, who's taken over from Dr. Van Diemen overseeing the contact tracing department?
There's a number of people that are involved. It's a pretty big team, so I'm involved in that. Rhonda Stewart and Paul Johnson are also involved in that, and there's also people that have been there since the beginning. Obviously, we're relatively new, and there's a lot of people involved in all of that.
Recently, what did you think about how it was all working when you came in?
Look, I came from the Alfred Hospital, and we've been dealing with the health department for quite some time. I've called Annalise Van Diemen at 3 o'clock in the morning on some occasions when things have happened. It's a really tough job, and we're certainly under no illusions that there's a lot of work to do. It's a very big operation. It's doing as best it can, and we really need to continue with that.
Do you have any numbers on how many cases there are in disability accommodation at all?
I don't have. We'll have to see what we can get back to you. Yep.
A question on apprentices.
Well, can I just go to the St Basil's issue just very quickly? I think it was yesterday, might have been the day before, when I was talking about the number of shifts that we've covered. It's now 700-800 shifts, I think. Hospital nurses going into aged care facilities, particularly those that were in the most acute crisis. Beyond that, though, as we see stability and as the traditional workforce take over again, we are looking to have a number of nurses, hospital nurses, remain on site to provide assistance and guidance, kind of a blended team, if you like, so that there's people from both the private operator but also some other hospital nurses just to support them in that important work. If I can get any further detail about the specific arrangements for St Basil's, I'm happy to try and do that. On apprentices, Alex. Yes.
There's early reports that lots of apprentices that actually graduated this year got jobs after the 1st of March where they're actually eligible for JobKeeper, and so now they're only eligible for JobSeeker with reduced hours. Will you ask the Prime Minister whether he will consider changing that 1st of March deadline?
If you'll permit me to take that on notice, I'm more than happy to get some advice from the Skills Minister, and if that is something I need to raise with the Prime Minister, I will. As I've said many times now, I speak with him pretty regularly, and sometimes it's very small things, sometimes it's much larger stuff, but we've got an open dialogue and there are many different things we ask of each other. On that specific one, I'm happy to speak to Gail and get an update, and if I have to take that forward to the PM, I will.
There's also reports that one of Australia's biggest apartment builders has started letting off foremen, engineers, quite high-level construction people within Victoria. My understanding is it's quite substantial. Will these people's families be able to survive, considering that they're moving from quite a large wage to potentially $750 or $560 on the JobSeeker? Is there going to be a huge flow-on effect to the families of construction workers, and will you advocate for maybe possibly more in those situations?
Well, again, we're always in constant conversations with the Commonwealth about their policy response. It is, it's a good thing that hardship has always driven them in the decisions that they've made, and we fully support that. That's exactly the basis on which we've made our decisions as well. Again, we have to see how this unfolds. It is for a 6-week period. If we all work together, it'll be over sooner rather than later. We don't want it to be happening for a moment longer than it needs to. There'll be lots of different impacts in lots of different sectors, and that's why we're in constant dialogue, always listening, always making sure that those industries have got someone to turn to talk to, so that we fully understand what's going on. And sometimes there are things we can do, sometimes there are a whole range of different things that we can do that make a difficult situation just a little bit easier, and other times that feedback allows us to go to the Commonwealth and argue their case.
Has the union raised concerns at all that you've said move to a pilot light stage, but that you can't do that and that there'll actually be substantive job losses as a result of this in the long term?
Regardless of either setting, whether it's 25% or lower than that, there will be a number of sites that close for a period of weeks. I think that we know that. No one is pleased about that, but we're working very closely with unions, very closely with construction firms to make sure that we drive down the total number of people that are at work and moving around the community, so that we can drive down cases, and particularly in relation to the construction sector. We'll continue to engage with them. We'll monitor where the numbers are up to, Alex, and if things were improving, then there's always opportunities to make some changes. But seeing this through is the most important thing.
The Prime Minister.
Sorry, just one more.
Sure.
In terms of the numbers, we have requested that you originally said the $250,000 figure.
That was our estimate. There'll be that now will have changed a little bit. For instance, in poultry, when you go up from 2/3 to 80%.
For a breakdown of that, of where those jobs actually are, and I think that it hasn't been forthcoming, so I just really want to lock it in.
That will be that people, because until you settle matters, you can't make those estimates, and they'll only be estimates. We won't be able to give you.
But can we have a breakdown? You've announced the $250,000 people. Can we get a breakdown of it?
More than happy to ask the team to try and produce that for you.
The Prime Minister apparently has just estimated the cost of the lockdown to the national economy to be between $10 and $12 billion. So what level of responsibility does the state government, Victoria, have to take for that?
Well, Nick, there's costs all over the place, whether it be in dollar terms or in funerals. I'm not going to be trying to put a price tag on this. this is what we have to do. We have no choice. We have no choice but to reduce movement, reduce case numbers. Otherwise, this won't be 6 weeks, it'll be 6 months or longer. And we'll have to continue to bury people. We'll have to continue to deal with an economy that is essentially closed. If there was another way, then we would pursue that. But there is simply no alternative. We will not see these numbers reduce sufficient for us to open back up again unless we take these heartbreaking, difficult but completely necessary decisions, and that's why I've made them, because there's simply no alternative.
Were you surprised by that figure, 10 to 12 billion?
That's not a number that I have seen before. Again, I haven't seen the Prime Minister's comments. The ultimate thing here, though, is you can try and put a price tag on where we are right now, or you can then you could focus your efforts on the many tens of billions of dollars that will be the attendant cost. It'll be the cost of being shut until we get well into 2021. Ultimately, we've got to fix this health problem, and once we get that fixed, get that down to those very, very low numbers that we think we can keep a lid on, then we can start to open up again. That's the ultimate choice. There is not the luxury of being able to choose an effective health strategy at the moment and one that would see economic growth. That's just not on the table. That is not something that is available to us. And I'll put it to you that I think the economic cost will be far, far higher if we don't get these numbers down. And that's why we're making these difficult decisions, and that's why we're all working as hard as we can. And that's why we're very grateful to Victorians who are doing the right thing. We urge all Victorians to join them in doing the right thing, following the rules, seeing this through. It's not easy, I understand that. It's very, very challenging. But it's our only option. It's our only way forward to get to the other side of this.
JobKeeper changes come through at the end of the 6-week lockdown period. Obviously,
little bit after. Yeah.
Little bit after. What do you think it will mean for Victoria's unemployment rate? If the changes still go ahead.
Oh look, I'm not here to make a commentary about JobKeeper other than to say that I think it's put a floor under this, and it's been a very important tool for all of us to use. I have discussions that I think are probably best between the Prime Minister and I about what longer-term settings should be. I don't think it's fair to be lobbying him for things from this podium. I think we've got a very good relationship, and it's one that's based on working together closely, not necessarily broadcasting through the media the things that we might think are important.
Can I just clarify one final thing on hotel quarantine?
Sure.
Was it, before it was formulated as a system in Victoria, was it your idea to start hotel quarantine? Did you take that idea to National Cabinet? Was this whole notion of hotel quarantine your idea to start with?
There were discussions at National Cabinet about the number of returned travellers, and there was an agreement at National Cabinet to move to a hotel quarantine model. We had already put in place some other arrangements for health workers and for others who needed to isolate. There was a discussion, and it was agreed by all First Ministers because it was the right thing to do.
Did Victoria bring it up though first?
I can't remember the details of the meeting. It was one of, I don't know how many National Cabinet meetings we've had, many of them. I certainly was a very strong supporter of limiting international travel wherever we could. And for those returning citizens, returning Aussies, then we needed to make sure that we had a high degree of confidence that they were not spreading the virus. There'd be no stronger supporter of it than me. It's a very, very important...
Strongest supporter in National Cabinet for it?
Well, Simon, I'm not playing word games, mate. Like, seriously, we had a National Cabinet meeting. It's one of many, many National Cabinet meetings. I support the decision. The decision was taken after a consultation and discussion with all First Ministers, and that's probably the best I can do to answer your question. It's a Cabinet process, and I'm not going to stand here and give you word-for-word accounts. It operates at the Prime Minister's urging and full agreement by other First Ministers. It operates as essentially a subcommittee of the Federal Cabinet. So it's not whether I wanted to or not. It is not within my province to be going word for word on what occurs at National Cabinet meetings.
Was a ministerial submission signed that enabled taxpayers' funds to flow to the security companies that were engaged for hotel quarantine? And if so, which minister signed it?
Well, you're asking me about a Cabinet submission, Rachel, and it's not my practice to be talking about Cabinet submissions. In fact, I'm not actually permitted to do that. So what I think would be best is if we let Judge Coate look at those matters, and she will in fine detail, and then she will make findings, she'll make recommendations as she should, and that's the process that's been set up, not for the avoidance of scrutiny, but to ensure that there is scrutiny and that there are answers to questions that I want answers to and that every Victorian is entitled to have answers to. Any other issues? Well, we will collate that list of follow-ups and we will do our very, very best to come back to you on each of those tomorrow, or at least the ones I said I'd come back to you tomorrow. Thanks, guys. See you tomorrow.
Thank you very much.